Virtual reality headsets are changing the way people experience video games, but our next guest is adapting the technology to revolutionize surgery. Welcome back to the show, the Chief of Neurosurgery at UCLA Medical Center, Dr. Neil Martin. His patient, Lucas Dinas, is here, and standing in the background here is our tech operator, Yahav Taco, and also joining is Bo and John. They want to be in on this because this is such interesting material. It is I'm going to say it's a game changer, Doctor. Is that fair to say?
I think it's a step change upwards in the rehearsing and preparing for surgery, and I think it's going to allow us to get closer to that perfect outcome that's always our goal.
How does it work?
So this takes a standard medical image, compiles it into a three-dimensional object, if you will, and allows you to see it from every angle. And now with the virtual reality headset, you can actually fly inside the skull, look at the tumor from every possible angle, memorize the anatomy so that when you get to surgery, it's deja vu.
So this is all pre-game. This is all the pre-stuff done before you actually get into the surgery.
So this is preparation or rehearsal. This is like Tiger Woods going to the driving range before he starts the U.S. Open.
Right.
And we're also going to be using it soon in the operating room to reassess things as we move through the operation.
Got it.
All right, Lucas, thank you for being with us. And you had the operation. So what were your symptoms?
Well, last fall I started experiencing piercing headaches when I would bend over to tie my shoes, and those persisted for about 3 months. So finally in December I went to the doctor. He ordered an MRI, and on New Year's Eve I learned that I had a brain tumor.
Okay, so when you went and you had that MRI done, that's the standard procedure, right? These are two-dimensional images. That is sort of the old school way, I guess.
Exactly.
Now, right?
Two-dimensional, black and white, planar images, just like we see on the screen here.
Right.
So we can see one element of the tumor, but it really takes decades of experience to translate that in your brain into a three-dimensional view of what you're going to see during surgery.
And even then, it's still an interpretation of what you might be seeing in a black and white image according to different shades of gray.
Very much so.
Okay.
All right, so let's see the 3D surgical theater view. And doctor, tell us what we're going to be looking at.
Well, we're looking at a reconstruction of the skull here. This is Lucas's skull, reconstructed from a CT scan, combined with an MRI scan and an angiogram. And what we've done here is to construct a virtual craniotomy, an opening in the skull. That's where we're going to go through and actually operate on the tumor. So as we approach the tumor during surgery, and digitally, this image has subtracted the brain tissue out. So we're just looking at the tumor and the blood vessels in red. As we zoom in on the image, we can begin to see the surgeon's view of the tumor.
Which is, wait, what's the tumor? Show our
audience. The tumor is the white spot.
Okay.
The yellow is the skull base. And the red is the brain blood vessels coming out that supply the circulation to the brain. So our goal is twofold. One, identify the tumor and resect it, remove it. And second, preserve all the normal structures, the carotid artery, the optic nerve, all of the normal structures that are surrounding.
Can you show us where that is on there? Can you see the optic nerve and the carotid artery?
We can see the carotid artery just emerging from the backside of the tumor. And so here are branches of the carotid artery coming out, but we can't see it as well as we would like. And that's one of the beautiful things about this technology. We can fly inside the skull, and we can look at the backside of the tumor where the carotid artery is encased.
Wow.
It's like looking at the dark side of the moon, which you never see actually during surgery, but ahead of time we can actually see behind the tumor. So if we rotate the image, here that red structure is the tumor embedded, the carotid artery embedded in the tumor.
But one step further is with the Oculus goggles that actually take you, we're looking at it from the outside. This allows you to, when you're wearing these, to take you inside?
Inside. I can then fly over the tumor. I can, by turning my head and using a controller, reposition where I'm located inside the skull, and so I can walk around the anatomy. I can learn it like the anatomy of my bedroom, so that when I get to the operating room, I know intuitively where every structure
Well,
is.
let me try, because we have the goggles here, and I'm going to put these
I
on.
want to give you this kind of a tour of the
Okay.
cranium.
So let me take this.
He actually
All right.
gets to go inside.
So
the
this
brain.
is, yeah,
right.
for our audience, I'm going to go inside the brain right now and see. Oh, it's dark right now. Right, there we
Right,
are.
see
Okay,
it?
wow.
Okay.
Okay.
So what we see on this screen here is a little representation of your head. This is your perspective. This is where you're located right now, looking through the craniotomy at the
Okay.
tumor.
I see the tumor in front of me, okay?
All right, I'm going to zoom out so you can actually see the opening in the skull.
So if I were you, if I were a doctor, I would be able to kind of go inside and fly around. If I wanted to see the back side of this
So we're going to
tumor.
do that right now. I'm going to fly you right in through the craniotomy, through the opening in the skull.
Okay.
We're going to fly right over the top of the tumor.
Now if I just turn my head, I can follow this
Right.
as I go through.
Now we're on the other side of the skull. Now if you turn 180 degrees around, you're going to see the back side of the tumor.
Oh, my
Wow.
So as you move, the headset detects your position and gives you that perspective as if you are inside the skull. Now if you look straight up, you're going to see the top of the skull. If you look down at your feet, you're going to see that black hole there.
Yep.
Is the opening where the spinal cord emerges from the brain on its way to the neck and back.
Are you
Wow.
using this while you're actually performing the surgery, or just to check it out?
So we do this ahead of time, familiarize ourselves with every bit of the anatomy, and then refer to it periodically during the surgery.
Thank you.
In the future, we're going to merge the actual video image of the head with the digital image, and we'll be able to do all of it in one fused environment, virtual environment.
Well, will this technology improve the odds for our loved ones who are going to be having this surgery?
Well, I think this is going to allow surgeons to prepare much more effectively for an operative case. You'll be able to do the surgery faster. You'll be more confident about where the anatomy is. You'll be able to protect the critical structures because of that knowledge, and it's going to be a major game changer. And the surgeons of the future, the trainees now, are going to be able to look at an entire library of complicated cases and do those cases surgically in a virtual sense to prepare and short-circuit the training process.
So, and also, coming back to Lucas for a second, you can come back over and sit if you
Yeah,
wish.
please.
The script is completely different now when you share it with a patient, because before it wouldn't have sounded so well, but now with this, you had better news to share.
Well, you know, before we would say, when he asked questions about how can we take the whole tumor out, will we be able to protect the structures, very often the answer was, well, we're going to have to wait until we get in there.
Yeah.
Now, we can get in there ahead of time, get a much better feel, and give her a better perspective on his odds. And in this case, I was able to say it looks like the carotid artery can be separated from the tumor.
Yeah.
It looks like we can get it all out, and in fact, we did.
How did that affect you, sorry, Doctor? How did that affect you when you could hear that sort of news and it wasn't so gray, but a little bit more?
Sure. Going into the surgery, I was incredibly nervous. You know, in fact, I thought, you know, this could be the end. But when he shared with me afterwards, it was a tremendous relief that it eliminated the need for radiation or any further treatment. So it was phenomenal.
You made your decision already because you couldn't see in the 2D scan that the carotid artery was in back. You would have found it only during surgery. And then
Yeah.
you'd have to,
Right.
because a little slip of millimeter of your hand probably could have killed him.
Well, you're working through tumor, and all you see is a tumor, and then
Right.
all of a sudden the carotid artery
Yeah.
pops into view as you remove it. If you take one bite too many
Yeah.
with the instrument, you can
Right.
injure the carotid
Thank God
artery
for
and
this
cause bleeding.
technology.
Yes.
Wasn't this
Fantastic.
technology originally developed for video games?
Yeah.
Or entertainment, essentially?
Exactly. Exactly.
You never thought a gamer would help save your life, right?
We're going to have more information about Dr. Martin's
It's
work
incredible.
on ocular surgical Rift Theater on his website and on our website as well. Please come back with more
Yes,
on this,
this is-
because this is just going to keep evolving into
It's
sort of areas.
absolutely moving very
Yeah.
fast right now.
And we're
Good
glad you're with us today to
Hooray.
talk
Thanks
about
for
this.
having me.
Thank
Yes,
you, Lucas. Thank
and we're going to keep moving fast, and we're going to go spend some time with Debbie.